which are the 4 blood vessels that feed the heart its blood supply and oxygen. The blood that goes through the heart is not the blood that the heart uses for its own oxygen supply. There are 4 arteries called the coronary arteries, or 3 depending on how you want to count them. But there are 3 to 4 coronary arteries that wrap around the outside of the heart and furnish the oxygen to the heart muscle itself. When you don't get enough oxygen in your calf muscles, you get a charley horse or a cramp. When you don't get enough oxygen in your coronary arteries, you get a cramp in your heart, professionally known as a heart attack. The longer you go without oxygen to the heart muscle, the more heart muscle that dies, and subsequently you can have a fatal heart attack. So keeping the arteries, those 4 coronary arteries, open so that you can continue to furnish oxygen to the heart is extremely important. We know that cholesterol builds up in those arteries, hence that's why we do bypasses and stents and so forth to keep those coronary arteries open. But this is, and heart disease has remained our #1 killer for years, at least since the 50s, since 1950. Despite the advent of Lipitor and all the drugs that have lowered cholesterol, heart disease and hardening of the arteries still is our #1 killer. This is a study that was published in the Archives of Internal Medicine where they looked at people that were given standard therapy for heart disease, so that's your drugs, versus the standard therapy plus what they call behavioral therapy. And the behavioral therapy included 5 components such as setting specific goals, skills training, spiritual development, stress management, time management, and so forth. So lifestyle education is what came along with this. I was absolutely astounded at the numbers in this study and how it reduced the risk of heart disease. And researchers took 2 groups of individuals that had heart disease. Basically, they gave one group the standard medical care for reducing the risk of heart disease, which is drug therapy. The second group got the drug, but also got behavioral therapy with it, stress reduction techniques. They were given a 2-hour session 20 times over the course of a year. So not even once a week did they get these sessions on just stress management. At the end of the year, they decided to look at the 2 groups and evaluate who had the most significant death rate as a result. There were 41% fewer deaths and 45% fewer heart attacks in the group that received the stress management technique. My question is, how many doctors, especially cardiologists, bother to try to inform their patients how important stress reduction and the role stress has in leading to heart disease? We're quick to take our Lipitor, we're quick to eat chicken, but we're not so quick at understanding the impact that stress has on our lives. So folks, whatever it takes for you to understand how to reduce your risk of stress, learn how to do that. It makes a profound difference in 41% fewer deaths from heart-related episodes and 45% fewer heart attacks.